growth of the global population and greater incomes have led to an increase in consumption and demand for lean meat. However, this also creates competition for resources such as feed, water, and land, and challenges animal agriculture to utilize fewer of these resources, but more non-traditional high-fiber co-products to supply dietary calories to pigs. However, pigs traditionally utilize these high-fiber co-products less effectively, and so overcoming some of these challenges, we'll need to identify new strategies in order to enhance the global competitiveness of pork production. It is commonly accepted that boars utilize fewer of these resources by having reduced feed intake, greater growth rate, reduced carcass fat, and thus an overall improvement in lean gain efficiency relative to the traditional barrow. So it would be advantageous to utilize boars in pork production. However, boars produce unpalatable off odors, also known as boar taint, particularly in adipose tissues with advancing age, as well as displaying aggressive boar-like behaviors. So in order to capture the growth advantages of the boar while still mitigating the development of boar taint, new technologies would be needed. Improvest is one such solution, internationally known as Improvac, VVAX, or Inisure. Improvest is an FDA-approved temporary method of immunological castration. It is like a vaccine in that the pig produces its own antibodies, and in the case of Improvest, antibodies against gonadotropin-releasing factor. It is administered as 2 subcutaneous injections by trained technicians, where the first dose is administered at least 4 weeks before the second, and the second dose is administered 3 to 10 weeks before harvest. 2 weeks after that second dose, then, a quality assurance inspection is conducted, where technicians are primarily looking for boar-like behaviors, and any pig failing to meet those specifications then would receive a third dose of Improvest. Immunologically castrating pigs does result in superior growth performance and leaner carcasses compared to the traditional barrow. However, consistently, immunologically castrated pigs have reduced dressing percentage. Likewise, as Kyle already discussed a little bit, feeding DDGS to gilts and barrows can result in adequate growth performance, but there are a few limitations, namely the resulting softer pork fat due to the high linoleic acid content in DDGS and reduced dressing percentage due to the high fiber content. And the softer pork fat and linoleic acid content is of particular interest in immunologically castrated pigs because we know these pigs are leaner. And leaner genotypes traditionally are more sensitive to dietary changes in fatty acid composition. So in order to overcome these limitations of feeding DDGS, new strategies have been sought out, such as withdrawing DDGS before harvest or gradually decreasing the inclusion as the finishing period progresses. However, it's unknown how such strategies would be effective in immunologically castrated pigs. So our objectives were to evaluate the effects of marketing time of immunologically castrated pigs using different DDGS feeding strategies on growth performance, backfat deposition, feed cost of lean gain, and pork quality, including pork fat quality. In this study, 863 genetopork pigs with an initial body weight of 21.5 kilograms were randomly assigned to one of 12 treatments in a 3x4 factorial arrangement. The 4 dietary treatments were fed over 4 dietary phases, where phase 1 was fed for 3 weeks, phases 2 and 3 were fed for 4 weeks each, and phase 4 was fed for 5 weeks. Dietary treatments included positive control, which we noted as pecan, where pigs are fed 0% DDGS throughout the entire growing finishing period, or a standard corn soybean meal-based diet. DDGS step-down will be noted as SD, where pigs were fed decreasing levels of DDGS as the growing finishing period progressed. DDGS withdrawal will be noted as WD, where pigs were fed 40% DDGS in phases 1 through 3 And then in the final phase, which was 5 weeks, pigs were fed 0% DDGS, or a standard corn soybean meal diet. And then lastly, the negative control we noted as NCON, where pigs are fed 40% DDGS throughout the entire growing finishing period. All pigs received the first dose of Improvest at 11 weeks of age. And the second dose of Improvest was administered to 1/3 of pigs at 15 weeks of age, the next 1/3 of pigs at 17 weeks of age, and the final 1/3 at 19 weeks of age. This corresponds then to pigs receiving that second dose at either 9, 7, or 5 weeks before harvest, fitting within that 3 to 10 week marketing window. And these treatments will be abbreviated as TD9, TD7, and TD5. And all pigs were harvested at 24 weeks of age. And I want to emphasize that in this study, all pigs were immunologically castrated. The DDGS used in this study contained 10.4% crude fat, and all diets were formulated to meet or exceed the NRC requirement for growing boars. And diets were formulated to have a similar SID lysine to ME ratio within a given phase. For growth performance, pigs were weighed and feed disappearance determined at the beginning and end of each dietary phase and 2 weeks after the beginning of phases 2 through 4. From this, average daily gain, average daily feed intake, and gain efficiency were calculated. And then body composition was determined by real-time B-mode ultrasound for 10th thread backfat depth, and all ultrasonography was conducted by a single trained technician. And ultrasonography began when pigs received the second dose of Improvest. Statistical analysis was conducted in SAS, where Penn was considered the experimental unit, growth performance and proc mixed, where weak was included as a repeated measure, body composition or back fat using proc glimix, and then pork quality and pork fat quality using proc mixed. And significance was declared when P was less than or equal to 0.05. For the following line graphs, the arrows will indicate when the second Improvest dose was administered. For example, TD9 is represented in the blue line. The blue arrow indicates that those pigs received the second dose at 15 weeks of age. And the same is true for TD7 in yellow, receiving the second dose at 17 weeks of age, and TD5 in red, receiving the second dose at 19 weeks of age. Typically, we would expect to see a gradual decline in gain efficiency as the growing finishing period progressed. However, for each Improvest treatment, the 2-week time period before compared to the 2-week time interval after the second dose of Improvest was administered, gain efficiency did not change, or it was improved. So that particularly during the 17 to 19 week interval, TD5 pigs had improved gain efficiency compared to TD9 and TD7. This resulted then in an overall improvement in gain efficiency of TD5 pigs compared to TD9. Overall average daily gain was not different among our Improvest treatments. However, those changes in gain efficiency also occurred at a time when average daily feed intake was increasing. There was no change in average daily feed intake across the Improvest treatments until the 17 to 19 week interval, at which time TD9 pigs had greater average daily feed intake compared to TD5 pigs, and at the 19 to 21 week interval, TD5 pigs had reduced average daily feed intake compared to TD9 and TD7. In terms of dietary treatment, pigs fed positive control and the step-down feeding strategy had similar gain efficiency, but both had improved gain efficiency compared to pigs fed the withdrawal and negative control feeding strategy. Overall average daily gain was greater in pigs fed positive control compared to pigs fed negative control. And the increase in average daily feed intake was particularly apparent in pigs fed the withdrawal feeding strategy and increased from the 19 to 20 week interval compared to the 21 to 24 week interval. And if you remembered, we removed the Distillers at 19 weeks of age. So that in the final 3 week feeding period, pigs fed the withdrawal feeding strategy had greater average daily feed intake compared to all other dietary treatments. These changes in average daily feed intake were also reflected in changes in backfat deposition. Particularly the pigs marketed at 9 weeks after the second dose of Improvest, again, by removing that DDGS at 19 weeks of age, resulted in a rapid increase in backfat deposition. So at 21 weeks of age, pigs fed the negative control had less backfat compared to all other dietary treatments, and this then continued at 24 weeks of age as well. When we consider pigs fed the negative control feeding strategy, at 21 weeks of age, TD5 pigs had reduced backfat deposition, which we would expect. Those were pigs that were boars for the longest period of time. However, TD9 pigs, the increase in backfat deposition tapered in that final 3 weeks, so that TD7 pigs had greater backfat deposition compared to both TD9 and TD7. Dressing percentage as the proportion of live animal represented in the carcass was reduced in TD5 pigs compared to TD9 and TD7. And pigs fed the negative control feeding strategy had reduced dressing percentage compared to positive control. But both the step-down feeding strategy and the withdrawal feeding strategy had intermediate dressing percentage compared to both positive and negative control. Now, of course, the producer is going to be most interested in how this impacts them in terms of economics. Considering that we had changes in body composition as well as dressing percentage, so hot carcass weight as well, though I didn't present that data, using lean gain, the NPPC equation for loin eye area, 10th rib back fat, and hot carcass weight, we calculated diet cost as it represents about 60 to 80% of total production cost, and then put that on a lean gain basis. Now, when we put it over 3 different pricing scenarios, we thought we were capturing all of the variation and volatility of the grain market. This was put together about a year ago, so we've kind of fallen off below the low end, but it still represents, there's still a take-home message here, and that is relative to pigs fed the positive control feeding strategy, pigs fed the step-down feeding strategy had a far greater cost savings in terms of lean gain compared to both the withdrawal feeding strategy and pigs fed negative control. So as I highlighted earlier, one of the limitations of feeding DDGS is the resulting soft pork fat, of which leaner pigs are more sensitive to dietary changes. We had reduced backfat deposition, particularly in TD9 and TD5 pigs that were fed the 40% DDGS or negative control feeding strategy. So this warranted further investigation into the pork quality and pork fat quality consequences. A subset of these animals were selected at 13 weeks of age for harvest at 24 weeks of age. And at 24 weeks of age, those animals were transported to the University of Minnesota Meat Science Laboratory. Pigs were harvested and chilled and then fabricated, and we used the Canadian back loin to determine subjective firmness and marbling scores, as well as drip loss and purge loss of the loin roast. 45-minute and 48-hour pH post-mortem were determined on the longissimus muscle or the loin muscle as well. And then we collected subcutaneous belly fat for fatty acid composition and calculated iodine value analysis from the anterior dorsal corner of the belly. Loin pH is a commonly measured pork quality trait as it has implications in terms of color and texture and firmness of pork quality. Timing of Improvest treatment did not affect 45-minute or 48-hour pH. However, pigs fed the negative control feeding strategy tended to have a greater 45-minute pH compared to pigs fed the negative control, and this is possibly due to that higher or lower energy content of that DDGS diet having less energy or glucose available to be metabolized to lactic acid in that conversion of muscle to meat and anaerobic metabolism at harvest. However, by 48 hours post-mortem, changes in pH then no longer existed. There was no effect of dietary treatment or timing of the second dose of Improvest on drip loss or purge loss. Also, there was no effect of the Improvest treatment on subjective marbling or firmness of the loin. However, subjective marbling scores were lower in pigs fed the step-down and negative control feeding strategies, so both of those diets contained DDGS right up until the time of harvest, compared to pigs fed the positive control feeding strategy. Pigs fed the withdrawal feeding strategy had similar subjective marbling scores compared to all other dietary treatments. Subjective firmness was reduced in pigs fed the withdrawal feeding strategy and negative control compared to pigs fed positive control, and tended to be reduced in pigs fed the step-down feeding strategy. Calculated belly fat iodine value was greatest in pigs fed the negative control feeding strategy, which we would expect. However, by using the step-down or withdrawal feeding strategies, belly fat iodine value was reduced, though not to the level of pigs fed the standard corn soybean meal-based diet in the positive control treatment. Pigs, TD5 pigs tended to have, or they did have, slightly greater calculated iodine value compared to TD9 and TD7 pigs. But it is important to note that all iodine values were below commonly used industry acceptability thresholds. You'll hear 74 sometimes you'll hear 73, but all Improvest treatments were below commonly used values. So in summary, gain efficiency improvements occurred when feeding the DDGS step-down strategy and marketing pigs 5 weeks after the second dose of Improvest. Changes in backfat deposition were greatest, particularly when pigs are fed the negative control feeding strategy and when marketed 9 and 5 weeks after the second dose of Improvest. By removing DDGS from the diet, backfat deposition rapidly accelerated. And when we combine all of these characteristics together, diet cost of lean gain was reduced relative to pigs fed the positive control when fed the step-down feeding strategy. Carcass composition influenced time of second Improvest dose, while the dietary treatments tended to affect more of the lean and pork fat quality. So kind of our final take-home messages in terms of growth performance is that the selection of a DDGS feeding strategy and timing of that second dose of Improvest due to the lack of an interaction are decisions that can be made independently. In this study, we optimized growth performance when using the step-down strategy and marketing pigs 5 weeks after the second dose. Diet cost of lean gain was the greatest when using the step-down feeding strategy due to those changes in body composition and dressing percentage. And then feeding the 40% DDGS resulted in softer loins with less marbling and higher belly fat iodine values. But the interval between the second dose of Improvest and harvest really had minimal changes on lean and fat quality. So in order to achieve our ultimate goal of producing more lean pork for consumption with fewer resources, new tools and strategies will need to be identified and implemented that improve nutritional efficiency and thus promote the competitiveness of pork.